just realized this is actually a Lulu tracksuit.
Yeah.
That's all. I'm jealous. Nicole, this is what I want for Christmas. I want a Lulu like tracksuit like this one. Before we actually get into it, if there's any shout-outs that Jamie would like to offer someone.
Yeah, absolutely. Give a shout out to my nephew Luca. I know he loves the YouTube, so he'll definitely appreciate it.
Relax it. Nice. Who did you go see? Who left these red marks on your back? Jamie, good to finally see you in here, man.
Yeah.
So, Jamie and I guess you can say we're related. So he's my girlfriend's brother-in-law at this point. See him pretty much every Sunday for Sunday lunch. I'm very thankful to finally get him on the channel. So Jamie, he's in today from like a wellness kind of component. He's got neck discomfort, some upper back pain. Do you mind walking us through a little bit of that, Jamie?
Yeah, I get I find after working out sometimes, got a bad habit of not stretching.
Yeah, I mean, so do I. Honestly,
Yeah.
it's terrible because I tell people that they should be moving all the time. But so you'd say that you probably don't warm up sufficiently for you, huh?
Yeah, and on top of that, when you're an accountant sitting at a desk all day, it doesn't help either with,
Right.
with the upper back and the neck. So
That's fair. So you got the hobbies. The good news is that like I know you work out hard. Okay,
Yeah.
like I think it's every Sunday. I feel like it's like 6 a.m. You're up. You gotta get as
Yeah.
much activity in before Fernando loads us up, right?
Oh, absolutely.
And, yeah, it's gonna be family shout-outs on this one, and so that's great. Okay, I feel like a big part of my job is actually encouraging people to do that part. You're already doing the hardest thing.
Oh,
right?
yeah, absolutely.
But then the job and the stress compounds into that. So there's obviously things you can do to manage. I know you've seen chiropractors before, right?
Yep.
And they kind of helped you out to good effect.
Oh yeah, no, absolutely. Yeah, if I had any knots, they helped me like release some of those
Awesome.
pressure points.
Out of curiosity, you seen physio or massage therapists before too, or no? Just kind of chiro.
Physio actually when I tore my left
Rotator
shoulder.
cuff?
Yeah,
Okay.
yeah.
How long ago was that?
That's probably maybe a couple of years.
Okay, actually. Oh no, I remember you telling me about that.
Yeah.
You were bench pressing, and then suddenly you
Yeah.
couldn't get the.
Yeah.
Back when ego lifting was all we would do, right?
Yeah.
Okay, so it seems pretty simple. I've treated you before. You kind of
Yeah.
know what you want. I already know what he wants, anyways. But what we're gonna do today is we're gonna get into the physical exam. Okay, we're gonna do a full-on treatment. I don't think I've ever given you like a full instrument-assisted soft tissue therapy treatment and everything. You're gonna be brave.
Yeah, absolutely,
I showed him some
Yeah.
pictures of this. He's a little nervous, but it's gonna be
Yeah.
great. And hopefully have you feeling good as new for tomorrow.
Yeah,
Right? Do you
looking
have any
forward to
questions
it.
about that at all?
No, absolutely.
Perfect. Let's
Get
get into
started.
it. So again, I've treated Jamie before, so I already kind of know what to expect here, but we're still going to do the physical exam because that's what we do on this channel. So first things first, I'm going to get you to rotate your head as far as you can to the right for me. We can get to about, is that as far as you can go? Okay, good. I'm going to keep the shoulders square. Go again. Sorry, to the right. We get to about 45, maybe 50 degrees. Let's rotate as far as you can to the left, please. We can actually get a lot further to the left side. Here we can get to about 70 degrees, so about a 15-degree asymmetry. That's when you start to know, okay, maybe we do need to do a little bit of work in here. I'll get you to bring your chin down to your chest for me, okay? Is that provoking any stiffness, pulling sensation either in the neck or down into the upper back at all for you?
A little stiffness in the neck.
In the neck, kind of up top or lower down?
Lower down.
Lower down. Okay, so again, kind of into where the meat of those traps come. That makes sense with this. You get you to look up towards the ceiling for me. Any pinching sensation in the neck or upper back once again?
Yeah, in the middle.
In the middle of the neck, right thereabouts. Or, yeah? Okay, I'll get you to face forward. Tilt right ear to right shoulder. Perfect. So there we're able to get to about 50 degrees, left ear to left shoulder. There we're at about 40. So again, we have an asymmetry with less available range of motion on that left side as compared to the right. So that can mean one of two things. That can mean either we get a joint lock up on the left side, it doesn't want to move and give in that direction, or we have hypertonicity of the right side muscles not wanting to relax and let him move that way. Which way is it? I don't really know. Does it really matter? Not if you're going to treat in a diversified manner, work both the muscles and the joints, which we can do. That being said, feeling through, his right side does feel more tense than the left, so right now I am leaning more of a muscular complaint, but again, let's just be diversified and treat everything. Get you to give yourself a tight hug, perfect. Rotate as far as you can for me. Good, so here we can get to about, that's an 80 degrees, 70 degrees, now rotate to the right. Here we can get to about 70 degrees again, so the upper back seems like its mobility is preserved, which is awesome. Yeah, less concerns about that one. Good stuff. Oh, I just realized this is actually a Lulu tracksuit.
Yeah.
That's all. I'm jealous. This is what Nicole. This is what I want for Christmas. I want a Lulu like tracksuit like this one. Okay, you were just telling me about that last night. Oh, look at that. We already had a pop. So I should stop talking. But Jamie, historically gets his upper back worked and his neck as well. So I'm going to feel up the upper back. We're going to see what we can find. I'm going to be quiet while I do it because we already had some incidental poppings. And I want to make sure that the microphone is able to pick those up for you guys. So here we go. I gotta say, Jamie adjusts very interestingly, where I feel like each single adjustment was a single vertebrae, just pop, 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 pop. Some people, they get like the zippering, where you get the everything, but with you, it's very deep individual segments. What does that mean? Nothing in particular. I just think that it's a cool observation. That feels pretty good to me. Right now, Jamie has had his neck adjusted many times before, but it's been a while since I've had the privilege of doing so. I was wondering, before we actually get into it, if there's any shout-outs that Jamie, or as I like to affectionately call him, Jimmy, would like to offer someone.
Yeah, absolutely. Give a shout out to my nephew Luca. I know he loves the YouTube, so he'll definitely appreciate it.
We'll see at the next, probably Christmas Eve. We'll see you then. Oh my God. Is his mind blown right now? His mind's probably blown right now.
Absolutely.
Yeah, for sure. Mm-hmm. And don't worry, Katerina said she was going to come on too soon, so she won't let you down, Luca, I promise you. I'm a terrible, terrible person. Okay. All right, so getting this neck here. Going to get you to turn as far as you can to the left for me, please. As far as you can to the left. Good. And just drop that head into my hand. Just relax it. Woo!
Oof.
That was a really good one. We got some of the dancers next door walking by wondering what's going on after that. For those who don't know, my practice is right next to a dance studio and a karate studio and a personal training gym. So, location, location, location. All right, on to the other side.
Do you have a lot of patients from those areas?
Occasionally I'll get the parents, because like I have the sign right out there which has just about every complaint that parents have, headaches, back pains, stuff like that. So like they'll just be standing out there socializing, and then one will be rubbing their neck and they'll look at the sign and be like, oh, and then they'll come in for a conversation. Yeah, it's definitely been beneficial. Not as beneficial as YouTube, believe it or not, but it's been beneficial. Some tension there. So good. Oh, sorry, do you have a question?
Right where you had that finger right there. That's
that
pain.
spot
That's
right
pain.
there. Yeah, that's a big muscle knot down there. That's maybe, well, it's his left side, maybe like C4, C5, lower down for sure. Okay, drop that head into my hand. Good. Nice. Yeah, you can tell by how calm he is that this is not his first rodeo for certain. At least when it comes to adjusting. I can tell you it is his first rodeo for what's about to happen. And he's totally not stressed about it at all, which is great.
I trust you.
I'm glad you do. So Jamie has never had the luxury of instrument-assisted soft tissue therapy massage. I showed him some of my other videos of exactly what it is and what it looks like. He's nervous, but he's brave. He's a brave guy, all right? We all wish we could be a little bit more like Jamie deep down inside. So we're going to get started now. And Jamie, I want you to know, if this hurts too much at any given point in time, you can just say stop. But I'm not anticipating that it will, okay? Like, this shouldn't be any more, like, does this hurt? Probably not, eh?
No.
Exactly. No more than, like, an actual massage would. Now, let's see if we can get any of that petechiae redness that I was showing him earlier, and then I'll do my usual ramble when it shows up. There's some there.
Everyone's really going to appreciate the redness afterwards.
Oh, yeah. Don't tell her you came here. Katerina is his wife and girlfriend, my girlfriend's sister, so just for context, people watching. Just be like, who did you go see? Who left these red marks on your back? So this is that petechiae. It's showing up right here that I was talking about. Don't worry again about it, Jamie. It clears up within 72 to 96 hours, okay? So you might need to take a break from your usual photo shoots, but otherwise you're fine.
This is the only red marks I'm allowed to have on my back.
From another person,
Yeah.
yes. Yeah. It is, we're joking about that, but it's actually really funny how frequently I need to give people a warning about the reaction that the spouse will give. Like if I have a guy in here and like I'm beating up his back like this because he's like a hard laborer, etc., he'll have petechiae everywhere, right? And I have to tell him, be like, look, you're gonna go home tonight. You're going to take your shirt off to shower or go to bed or whatever. Your wife's going to see you and she's going to freak out, okay? You need to reassure her that this is normal. And you can tell her that I told you about this exact scenario. And 90% of the time, that exact scenario plays out, right? So we're making a joke, but it's actually, there's a lot of truth in it, so. You might need some more over there. That there if you can. Oh, is that relaxed? You are calm? Damn, you're just jacked. Okay, that's what that is. My bad.
What, is it tensed?
It looks tensed, but like you're actually like that's just you. That's your normal muscle tone. You work hard, dude. Never let anybody else tell you different. There we go. That's the angle. Okay, now something to recall is that Jamie was having issues rotating to his left side as compared to the right, which implies that we also, or the possibility that it's the muscular hypertonicity, it's been a long week, that's holding him back on that side. So I would want to scrape really up here in the traps, and it's easier to actually do that with the patient sitting up. So for the next take, that's what we're going to do. We're actually going to get you sitting up, Jamie. Just relax the traps as much as you can. There we go. Let those shoulders fall. And we'll get into scraping the upper traps and a little bit into the neck too, okay? He looks so calm. He's got his eyes closed. He looks like he's falling asleep. He's one of the toughest guys I know. People usually find this to be uncomfortable, but he's doing way better than he probably thought that he would.
It's a little bit relaxing.
A little bit. That's okay. That's fine. That's what I go for. Yeah, I don't think the camera can pick this up from this angle, but I'll show you later. Show the camera, you guys later. This right there definitely got that showing up too. We'll also scrape his other side just to be comprehensive, even though, again, I think therapeutically, this is the more important side to do. Okay, let's do the left side. I should get my hand out of there. There we go. This is the best angle. Okay, not as much petechiae showing up here. Maybe I spoke too soon. I take that back. Yeah, I definitely take that back. Never mind. There we go. Good stuff. So we got some there. We got more. I'm going to move the camera kind of right on over there showing up. So overall, I'd say that, yeah, you've never had an intervention like this before on your fascia, have you, Jamie?
No.
I don't think so. You've had the cupping, right? Cupping, once again, some practitioners like to use it to address the fascia. It's totally viable. It's something you can do, absolutely. I prefer to use the tools because it's more of a broader area. So, good job. You did great. We're going to clean you up now. Jamie, I'm going to get you to face forward. Rotate once again as far as you can to the right for me, please. Good. So here we're able to get to about, I'd call that 60 degrees now. And you can face forward once again. And we couldn't break 45 before. Okay, so that's a 15-degree improvement instantaneously. To get sustained improvement, consistent input requires consistent output. That's true of anything. If you want a healthy heart, you have to go on 3 runs for the rest of your life per week. I'm not saying you need to go to see a chiro 3 times a week or whatever, maybe off the start if you're in an acute complaint, but like regular intervention, either mobility, yoga work, chiro, massage, physio, osteo, those things are all methods to make sure that these things can be more than just transient benefits. Anyways, let's do some additional massage work. And you should look up and to the right for me, okay? Good. And now slowly down to the left, go ahead. Good. Up to right. Slowly down to the left. Now, if I'm pressing too hard, you let me know, okay? But
no, it's all good.
I'm under the impression that you're pretty tough. So, up to right, down to left, and up to right, down to left. Good stuff. Face forward. Tilt your right ear to your right shoulder, please. Crushed it. And now your left ear to left. Go ahead, slowly. Good. Right to right. Oh no, sorry. Come like all. There we go. Good. And now slowly left to left. Go ahead. Right to right. Left to left. And right to right. Left to left. Ooh, that right there. Let's go one more on that, okay? Right to right. Left to left. Yeah, that's going to need some more work. That's fun though. It's fun for me at least, maybe not for you.
Yeah, felt that one.
Yeah, I'll get you to look up into the left for me, please. Crushed it. Now slowly down to right. Go ahead. And up to left. Slowly down to right. Up to left. Slowly down to right. Up to left. Slowly down to right. face forward. Tilt your left ear to your left shoulder, please. And now we're going to tilt right ear to right. Go ahead, slowly. Good. Left to left. Go ahead, slowly, right to right. Left to left. Right to right, slowly. And left to left. Right to right, slowly. Good job, Jimmy. Well done.
Beautiful.
Jamie, how did you find all of that? I mean, like, we adjusted you with your experience with, I guess I'm more interested in how you found the scraping and the instrument-assisted soft tissue therapy. What did you think of kind of that component today?
Yeah, I think going into it, a little bit nervous, seeing the after effect, the redness. Haven't done it before, but I think going through it and probably experiencing wasn't as bad as I initially thought, and honestly, and you do feel like the improvement right after.
Very happy to hear that. As a practitioner, it's always best to try to explain what you're going to do in as much detail as possible to a person. Obviously, don't get down into the histology of the thing, but like even just showing a picture before and after can avoid any kind of what the hell did you do to me's legal case down the road, right? Very interested to see what Katarina's take is on that when she sees it.
I have to really explain to her.
Yeah, without knowing, as a heads up, that's going to be fun. So overall though, we saw a noticeable improvement in the rotation. We're going to need to, again, or specifically, you're going to need to have some sort of regular intervention. That doesn't have to necessarily be here or any other practitioner. You can do that yourself with mobility and yoga work, or it can be a practitioner, your call. Did you have any other questions for me? Anything else that you wanted to talk about for today? And it's okay if the answer is no, but if you do have a question, ask away.
No, I think that's
perfect. Okay. Well, if that's the case, thanks for getting on the channel finally. Really appreciate it. And I guess we'll see the Anthornos and the Guimaranges. Oh, I can finally almost say it right on here. But anyways, take care.
Don't forget to like, comment, share, and subscribe.
And he wasn't reading that at all. Thank you so much, Jamie.